subject schizophrenia. We are celebrating today's World Schizophrenia Day, and I hope some hope will be there support in these schizophrenia cases. Would like to welcome Sri Chandrakant Bhanusali ji. I would like to welcome Venkat Joshi ji, Jayesh Thakkar ji, Mahesh Daditi ji, Dr Navin Joshi ji, the founder of Ayush Darpan Foundation. I would like to welcome Sadanand Patri, all participants on behalf of Emami ZANDU, Independent Research Society, Ayush Darpan Foundation, and Vishwa Ayurved Parishad. I would like to welcome you all. Today's topic is schizophrenia. Moderator is Dr. Prof. here, founder of Beautiful Ayurvedic Clinic. Now I would like to request Dr. Prof. to moderate the session.
Thank you, sir. Thank you, Dr. Gopakumar Sharma, sir. On behalf of Independent Research Ethics Society and ZANDU, I would like to welcome Dr. S. Gopakumar, sir, and Dr. Suhas Kr, Shetty, sir. We all know that in this pandemic situation, all we are having this problem, which is called mental problem. We are having the fear of death. We are having the fear of what will happening after 1 month, after 2 months, what will happen. So we are doing pranayama, we are doing some meditation, and some of the Ayurvedic Vaidyas are taking the medicines which will help to calm down the vata. So in this prestigious occasion, I would like to invite Dr. S. Gopakumar, sir, to say something. Dr. Gopakumar, sir, is a professor and departmental HOD of Roga in Govt Ayurveda College, KANNUR. He got many prestigious awards in all over the India and the world. He teaches very beautifully he teaches very beautifully Ayurved, and we all know that his word, like the love Ayurveda, learn Ayurveda and live Ayurveda, is now become the mantra of each and every Ayurvedic Vaidya's mind. So I would like to invite to say something to Dr. S. Gopakumar, sir. Namaste, sir.
Namaste, Namaste, Arka. My humble pranamam to all the great Vaidyas and all the guest great personalities who are present in the platform. Shall I directly go to my speech, Arka?
Yes, sir.
Okay. How much time I can take?
1 hour, 45 minutes.
As you please, sir. As you please. Stage is yours. We are eager to listen your blessings to the society.
So at the end of the day, nobody should get the stress after my speech. Okay, thank you, sir. Thank you. So I am very happy to be here on this particular day, World Schizophrenia Day. And our science, Ayurveda, always give prime importance to the relationship between body and mind. We very well know when there is a happy mind, definitely there will be a happy body. And when there is a healthy body, definitely there will be a happy mind. So, Manas Sharirayo Stapa Paraspara Manupraje. That is the Indian popular saying. Manas Sharirayo Stapa. Tapa means the Sandapa, Dukha. They are always mutually dependent. And coming to the topic schizophrenia, we very well know it is a chronic mental disorder where the patient is losing the reality sensation. Patient will not be having the reality sensation, and he will be thinking that he is having a different personality, different identity. No doubt schizophrenia is coming under psychosis, where the insight of the patient will be very much reduced. So we can always tell that the patient suffering from schizophrenia will be having an abnormality in reality sensation. For appreciating the reality, there will be a difficulty for the patient. And we very well know when Atma, Mana, Indriya and Sharira work together. Atma, Mana, Indriya, Sharira work together, we are really getting the Pratyaksha Jnana. Pratyaksha Jnana means the sensory perception is possible only where there is Atma, Mana, Indriya, Artha, Sannikarsha. In schizophrenia, what is happening? The patient is losing reality sensation and the patient will be having hallucinations and delusions. We very well know so many patients we are getting in our daily OPD, especially in our Manasiga OPD. In my college also there is special Manasiga OP where we are getting patients, and occasionally we are getting patients from schizophrenia, and they will be presenting with the disturbances in their thoughts, difficulty or disoriented speech, emotional fluctuation. They will be having problem in using the proper language, and they will be suffering from hallucinations and delusion. Delusion means false belief. We can give enough proof that this is not correct, but the patient will stick on to his own false belief. That is what is called delusion. When you come to Ayurveda, you can see a beautiful heading of diseases under the umbrella called Unmada. When you go to Charaka Samhita, Charaka beautifully defines Unmada. I am not using any PowerPoint, I am talking freely because that is easy for me to communicate with you. Unmadam Punaha Mano Buddhi Satya Jnana Smriti Bhakti Sila Cheshta Achara Vibramam Vidya. My dear friends, follow me once again. Unmadam Punaha Mano Buddhi Satya Jnana Smriti Bhakti Sila Cheshta Achara Vibramam Vidya. The patient will be having certain deviation from the normalcy in the following criteria. Buddhi, Sapnya, Jnana, Smriti, Bhakti, Sila, Cheshta, Achara. He will forget who he is. He will not be able to remember what was his normal plannings and works. He may not be able to remember what is his normal intellectual capacity, what is the memory, what is the Achara, what is the normal routines he was doing. So gradually the patient will be withdrawn from the social scenario. The patient may get extracted towards a particular area where he will be having less communication. Socially, with social withdrawal and going to the loneliness will be a main feature in Unmada. And Charaka Samhita beautifully tells Vadiga, Paitiga, Kapaja, Sanipadiga Unmadas. And when you go to Vagbhada, I am coming to the major contribution from Ashtanga Hridaya in Vagbhada. He is telling Unmado Nama Manaso Doshe Unmargadei Madai Sharira Manasayam Dushtaha. Here we can see the very much similarities of Vadigo Unmada and schizophrenia in our clinical practice. In the academic interest as well as research domain, we can see the clinical features mentioned in Ayurveda under the heading of Vadiga Unmada are very much similar with the schizophrenia. You know why? Because we very well know the mind is controlled by Vata. Let us salute Charaka again who told Niyanda Pranetaja Manaha Vata. Sir, there is a chapter in Charaka Samhita Sutrasthana 12th chapter, Vata Kalakaliya. There, Charaka is telling that Niyanda Pranetaja Mana, the controller, the supreme controller of the mind is Vata. And when we come to the three important domains of mental faculties, highlighted in Ayurveda, Dhi, Dhridi, Smriti. We very well know Dhi, Dhridi, Smriti. Dhi represents the intelligence. Dhridi represents the power to execute the intelligence. And Smriti is the recollection of the activities done with the Dhi and Dhridi. I think you are getting me. Three important mental components, very much highlighted in Indian Ayurvedic science, is Dhi, Dhridi, Smriti. And in Unmada, the patient is losing the reality because of Dhi, Dhridi, Smriti related pathologies. I am repeating, Dhi, Dhridi, Smriti related pathologies are affected by the vitiated Vata, and then naturally there will be the problems like Unmada. In schizophrenia also we are getting the same thing. The patient is feeling hallucination. The patient will tell, I am hearing some sounds. I am hearing some sentences which others don't hear. Then we will always tell that you are mad. but the patient is feeling certain sounds, auditory hallucinations are more common in schizophrenia. You know, there are different types of hallucinations: auditory hallucination, olfactory hallucination, visual hallucination. But the major component seen in the schizophrenia is auditory hallucination. Let us salute our Acharya who told Ashabda Sravanam. See the beauty, sir. Even before the inception of the World Health Organization, Ayurvedic Acharyas told about Ashabda Sravanam. The sounds which are not really present, I am hearing. So auditory hallucinations are mentioned in our science textbook. And when we go to the Unmada, Charaka is beautifully telling the clinical features of common Unmada in a beautiful way. It is very clearly mentioned, Vibrama Sattva Pariplavascha, Paryagula Drishti Adhira Daja, Abadha Vaktam Hridayasya Shunyam, Samanya Unmada Gadasya Lingamba. In very simple 4 sentences, he is picturizing everything about a psychosis. I am repeating, a psychotic condition where the patient is losing the insights and the patient is not knowing who he is. He is losing the concept that his Atma Bodha is distorted. His Atma Bodha is distorted, and then he is telling the clinical feature, Bhi Vibrama Sattva Pariplavascha. Bhi Vibrama. Vibrama means fluctuation of the intelligence. Sattva Pariplavascha. Sattva Muchyade Mana. Dear friends, in Ayurveda, the word Sattva is somewhat parallel to Mana, mind. Sattva Muchyade Manaha. Sattva Pariplavascha, the fluctuation of the mind and mental faculties. Paryagula Drishti Adhiradaja. Paryagula Drishti. The eyes will not be stable. Not only in the physical sense of stability, even the Indriya Artha Grahana also there will be stability. So, Paryagula Drishti. Even we can compare to the level of hallucination, visual hallucination, the rolling of eyes. Adhiradaja. He will lose the courage. The patient with schizophrenia will always feel unrealistic, irrational fear. They will always feel unrealistic, unrelated, realistic, and not realistic. The fear component will be there. That is Adhiradaja. See the third sentence, Abadha Vaktam. The vak, the word inputs, the word delivery will be Abadha. They will be talking irrelevantly. They may not be able to talk up to the situation. They don't know when they have to be happy. They don't know when they have to be sad. The emotional as well as emotionally driven speech will be totally irrelevant in Unmada. Abadha Vaktam. The next word is very much important. Hridayasya Shunyam. My dear friends, Hridayasya Shunyata. The Shunyata of Hridaya is not simply the emptiness. It is the emotional poverty. I would like to interpret the word Hridayasya Shunya as emotional poverty, where I cannot answer according to my emotion when the situation really demands. So I cannot perform, I cannot show my happiness, I cannot be not again from the domain of sad when it really required. So Hridayasya Shunyam is nothing other than emotional poverty. Hridayasya Shunyam Samanya Unmada Gadasya Lingam. Now, why I am telling the classical concepts? Because even though we are having that much of progression in modern mental health science, the roots are embedded in our Ayurvedic science. The basic roots of mental health issues mentioned in Ayurveda are still relevant even in the computerized stressed generation. I would like to tell you, when the sloga was written in the palm leaves, there was no computer. There was no digitalization. There was no IT stress. Even then, there was Unmada. So let us think about a stage when we are all having the emotional, physical, mental, and behavioral stress due to the all sophisticated instruments and health hazards. Can we imagine the quantity or the volume of incidents of schizophrenia? So I would like to once again tell what is Samanya features of Unmada. Dhi Vibrama Sattva Pariplavascha Paryagula Drishti Adhiradaja Abadha Vaktam Hridayasya Shunyam Samanya Unmada Gadasya Lingam. Okay, now let us see what are the reasons for schizophrenia. What are the main causes of schizophrenia? According to Ayurveda, Karya Karana Siddhanta is always there. inseparable relation between Karya and Karana, the product as well as the cause. According to the modern medical science, they are not able to tell a single reason, but they are telling that genetical components, familial tendency and inheritance, and the environmental factors, and the psychological trauma, all these three factors together contribute to the onset of schizophrenia. So the genetic patterns are there, the abnormality of psychological behavior, and even environmental factors. Environmental factors means the early childhood mental trauma can play a role. The early childhood mental trauma can play a role, and even certain viral infections, and even certain abuse of the drugs, even certain abuse of other things can also be leading to this type of schizophrenia. You know, my dear friends, Ayurveda mentions about one Unmada called Vishajonmada. Ayurveda is telling, if you take the addiction, if you have the addiction, if you take the narcotics, just like in the contemporary scenario, Ayurveda also mentioned about the Vishajonmada, Vishena Shyavavadana, Ashtachaya, Hadendriya, Vegandare Visampranda, Rektakshastam Vivarjaye. It is very difficult to treat. Ayurveda told. Nowadays, our generation is consuming all the so-called narcotics, but Vishaja Unmada was mentioned earlier. Okay, so what I am telling, according to Ayurveda, the Manasiga Roga Nidanas, Manasiga Roga Karanas are fitted at Ahara level, Achara level, Vikara level, Vikara level. I would like to tell 4 domains of causes in Ayurveda to get the mental disorders like schizophrenia. Ahara, Achara, Vihara, Vikara. All the things are very much important even nowadays. Okay, I will explain. When you come to the Ashtanga Hridaya, Uttarasthanam, Udmada, Pradishedam, there is a beautiful reference regarding the etiological factors of Udmada. I am going to recite that particular Shastra Bhaga for you. And then he is telling beautifully that Tatra Ahidad Annapanata. The very first word is Ahidad Annapanata. The Annapanas which are not good, the Viruddha Aharas. You know, Madhya, the alcohol. Alcohol is mentioned in Ayurveda as Tamagari Drevya. You know, Madagari Drevya is always Tamoguna dominant. We talk about Sattviga foods, we talk about Rajasa foods, we talk about Tamasa foods, but Ayurveda mentions a category which is called Madagari Drevya. Madagari Drevya will create intoxication to the brain, just like the alcohol and other derivatives. What is that? According to Sharangandara, Buddhim Lumbadi Yadrevyam Madagari Taduchade Tamoguna Pradhananja Yadha Madhyam Suradigam. So that is also mentioned. The Madagari Drivyas can also be here. So Tatra Ahida Dannapanataha Vikrita Asatme Samalad Vishad Uyogena and Yadivi Chena Dekasya. It is mentioned, if he is suffering from a disease, then there can be again Udmada. Shinasya Cheshta Vaishamya Pujya Pujya Vidikrama. See the beauty. Shinasya Cheshta Vaishamyad Pujya Pujya Vidikrama. If he is not able to recognize and respect the respected person, if his behavior is not good, then that itself will create an internal imbalance of stress, and that can go to the Udmada. Vishena, Upavishenava, Visha and Upavisha, all the food articles, preservatives, chemicals which we take in the daily life can also lead to the mental problem. The imbalance between dopamine and serotonin. The neurotransmitters mentioned in modern medical science, the neurotransmitters like serotonin and dopamine, and they are also coming under these Ayurvedic concepts. So the imbalance can be there a problem. Vishena, Upavishenava, Indivi China Dekasya, Chinasya Cheshta Vaishamya, Pujya Pujya Vidikramal, Adihis Chitta Vibramsha, excessive worry, excessive anxiety, excessive depression. Adi, the word Adi represents everything about a Vyadhi. My dear friends, Adi will be converted to Vyadhi. That is a very simple concept in Ayurveda. If your mind is suffering from Adi, it will be going to the Vyadhi status. Adi to the Vyadhi, Adi for Chitta Vibramshal, and Vishen Upavashenava. And what is the next sentence? Edirpi hina sattosya kriti dosha pradushidaha Atva margan manovahan. Evi hina sattosya. Sattva represents the internal mental strength. Just like we talk about the physical immunity, there is a mental immunity. Physical immunity, we know our blood cell counts, everything will tell you how much you are immunologically competent. Just like that, there is a mental immunity. Ayurveda used the terminology sattva to represent the mental immunity. If I am having minimum sattva bala, I will be easily affected by emotional stress. I think it is quite understandable. There are certain people who can tolerate everything. Whatever other people are telling, they don't mind and they will continue their work. There are certain other people who cannot even bear a simple sentence, they will be getting worried, and those people are coming under the category of Hina Sattva. So Hina Sattva people are more prone to develop Unmada as per Ayurveda. Edirdi Hina Sattosya Kriti Dosha Pradushida. Hridaya. According to Ayurveda, Hridaya is not the simple site of heart. Hridaya is the Chedana Sthana. See, the concept of Hridaya in Ayurveda is totally different from the modern cardiology. In modern cardiology, they talk about an organ which is doing the pumping function. But according to Ayurveda, Hridaya is Pranavahanam Srodasam Hridayam Moolam, Rasavahanam Srodasam Hridayam Moolam, and Hridayam Chedanasthana Muktam. The intellectual side, the emotional side, the circulatory side, and every physiologically controlling factors, everything is attributed to heart. So Ayurveda is telling in the Unmada Samprapti, Hridaya will be affected. Hridaya is affected doesn't mean that your heart is affected by cholesterol. No. Your heart is affected by atherosclerosis. No. Here the involvement of Hridaya means your emotions are affected. Actually the word Hridaya, Hridaya, you take it, you give it. So Hridaya is the organ which take and which give back. Hridaya, Ha represents take. Da means you are giving back. So you hear the words, you hear the emotion, and you are reacting to the emotion. That is Hridaya. If you are Buddha, if you are Mahatma Gandhi, you can tolerate everything and you will not be responding in a Rajasa way. But that is what is called Hridaya. When your heart is getting under control, then you will be patiently hearing using the both ears, and you will be talking 50% using only one tongue. That is the imbalance. So when there is an imbalance of aggressiveness due to Rajoguna, definitely there is a chance of Unmada-like features that is evident in schizophrenia. So that is the word told by Vagbada, Edirti Hina Sattosya Kriti Dosha Pradoshida Dhiya Vidhaya Kalushyam Atva Margan Manovahan Unmadam Kurvade. Dear friends, I am not going detailing, I am telling that Samprapti, the etiopathogenesis of Unmada in Ayurveda. There, heart, mind, head. The neurological component is head. The emotional controlling center is the heart. Both are equally given importance in the etiopathogenesis by ancient scholars. Dhiyo Vidhaya Kalushyam Hatva Margan Manovahan Unmadam Kurvade. And the next statement told in the Samhitas are very, very, very important. I was so much fascinated by, actually my interest to the Manasiga Roga Chikitsa was predominantly by this particular Shastra Bhaga. He is telling, Tena Nashta Sarari Vadradha Pramatya Jintidarabha. See the beauty? Just like the person who is losing the control to the vehicle, the patient will be behaving when he is suffering from Unmada. Nashta Sararivat Retha. You know Retha, the chariot, the oldest, the car. So the Saradi will be there. The Saradi will be controlling the Retha. But in case of this Unmada, the mind being the Saradi will be losing the control and the body and mind will be behaving according to its own interest. Deho Dukkha Sukha Prashta Nashta Saradi Vadrada Pramatya Jindidarambha. How beautifully Vagbada told. He never studied in a mental institute. He never took a PhD in psychiatry. He observed so many patients and he could identify what is happening in the patient. See the two lines. Deho Dukkha Sukha Prashta. dukkha, sukha. The positive and negative feeling he is losing. He is not able to identify what is good to me, what is bad to me. What is sukham according to Indian concepts? We mean sukha means we are getting good money. We mean sukha means we are getting good position. We mean sukha means we are getting all the familial convenience and everything. And nowadays we believe sukha means not getting COVID positive. Am I right? So that is the concept of sukha now. We are getting a vaccine and we are not getting COVID positive. That is sukha now. But Ayurveda is telling anukula vedaniyam sukham, pratigula vedaniyam dukkham. Both are vedana. Sukham, dukkham, both are vedana. Anukula vedana is sukham, pratigula vedana is dukkham. That is the Indian darshana concept. The Indian philosophical concept about the sukha and dukkha is anukula vedaniyam sukham, pratigula vedaniyam dukkham. So here what is happening? Deho dukkha sukha prashta nashta sarati vadrada pramatya jintidarambha. The patient will be not feeling what is real sukha, what is real dukkha. He is not able to distinguish the happiness and sad. That means emotional discrepitory power is totally lost in schizophrenia. And nashta sarati vadrada. Just like the person who is losing the control over the chariot and he will be moving here and there, and that is called mada. So till now, I told you how you can equate the classical schizophrenia to an Indian condition in medical sense called unmada, comparing the etiological and pathological steps. I think it is clear. So I am telling you the disease schizophrenia and the components mentioned in Indian medical science unmada share common features. So when we are asked to treat the unmada, we will go to the when we are asked to treat the schizophrenia, we will naturally go to the Vadigonmada and then we will start the treatment. Okay, I will come to the treatment after telling the clinical features of Vadigonmada. If you see the clinical features of Vadigonmada, Tatra Vadal Krishangada. The very first sentence is Tatra Vadal Krishangada. Krisha means lean. Due to the improper eating habits, the patient will become lean in Vadigonmada. The word Vadigonmada and schizophrenia share common features. I am not telling that schizophrenia is equal to Vadigonmada. We cannot tell about any disease in Indian science. We can tell that by observing closely the etiopathogenesis, we can tell the Unmada concepts and schizophrenia share certain common features. My dear friends, ultimately learning is nothing other than identifying the Samanya and Vishesha. What is learning? What is learning? Learning is nothing other than identifying the Samanyam and Vishesha, the similarity and dissimilarity. So there are similarities between Vadigonmada and schizophrenia. So I am going to tell the clinical features of Vadigonmada. Tatra Hidadanna Panadaha. Asthane Rodana Krosha Hasidas Timida Nartanam. See the beautiful sentence. Asthane Rodana Krosha Hasidas Timida Nartanam. I always keep this line in my brain. Asthane, irrelevant talking, irrelevant laughing, irrelevant singing, irrelevant dancing. See, the schizophrenia patient will be behaving accordingly only. Asthane Rodana Akrosha Hasidas Timida Nartanam. He doesn't know where to laugh, he doesn't know where to cry, he doesn't know where to behave normally. The behavior abnormality shown by the schizophrenic patient is beautifully picturized by one single line in Ayurvedic textbooks centuries back. Asthane Rodana Krosha Hasidas Timida Nartanam. What is the next line? What is the next line? Then he is telling Gida Vaditra Vaganga Vishe Vaskodana Nija. Gida Vaditra Vaganga Vishe Vaskodana Nija. He will be using the instruments in front of him. If the patient is coming to the doctor, you can see the patient is not answering to the doctor. He will be playing some musical instruments in the consulting table. When the doctor is asking, what is your problem? What is your problem? The patient will be playing tabla on the door. The patient will be playing tabla on the consulting table, and the patient will take the pen and use it as flutes. You are asking, the doctor is asking, my dear, what about you? What are the problems to you? Patient will, I don't have any problem, and he will take doctor's stethoscope and use it as a instrument for music, something like that. We are daily seeing it. That is Gita Navaditra Vaganga Vishwaskodananica. And what is the next line? That is very much important. Asamna Venu Veenadi Sabda Anugaranam Mukur. Asamna Venu Veenadi Sabda Anugaranam Mukur. All the improper behavior and all the imitations he will be doing. He will think that he is a musician. He will think that he is a dancer. He will think that he is a player. So he will be using all these things in front of the doctor. Then Asyal Venagamo Ajasra Madanam Behupashita. Asyal Venagama, Proti discharge from the mouth. Ajasram Behu Pashita. He will be over talking. Behu Pashita. The control over the delivery of words will not be there. He will be more talking. Behu Pashita. Griddhi Rabhyavahareshu Tallapecha Avamanita. The best sentence told by an Indian scientist regarding a mental disease is this particular sentence. Griddhi Rabhyavahareshu Tallapecha Avamanita. What is the meaning? He wants everything. I want this, I want that, I want that. But when he is provided with the thing, he doesn't like it. I think you are getting the experience. The patient will demand, I want this, I want that. And we will provide this, then the patient will tell, no, this is not what I was asking for. This is not what I liked. That is what is told. Griddhi Udyavahareshu Tallapecha Avamanita. Griddhi means uncontrolled desire for everything. Udyavahareshu. Tallape, when provided, Avamanita, I don't want. So this is the general behavioral pattern mentioned in Vadigonmada, which we can see as such in schizophrenia. And Ulpindida Arunakshattam Jirne Chane Gadodhava. So when the digestion is over, again the disease will aggravate in Vadika condition. So my dear friends, till now I told you about Unmada, I told you about the Nidana of Unmada, I told the clinical features of Samanya Unmada, I told the specific features of Vadika Unmada, and then you can easily compare how schizophrenia is etiopathologically related with the Unmada. Okay. Now, coming to the treatment of Vadika Unmada. We can use the concepts mentioned in Unmada Chikitsa for treating schizophrenia patient. You have to give medicines against the schizophrenia, antipsychotic drugs. You have to give the psychosocial support, and you have to give patient education, because the patient as well as his entire family and even society will be affected by schizophrenia. You have to give a training to the patient, not only the patient, to the relatives who is the first and second primary, secondary care providers. So patient education, family education, counseling, psychosocial support plus medicine. According to Ayurveda, we very well know the management of Manasika Roga, the management of mental diseases is mainly done by Shodhana Chikitsa and Samana Chikitsa. Shodhana Chikitsa represents the biopurification. According to the science, Bhagbada is telling, Atha Anilaja Unmade Snehapanam Prayojayir, Urva Mavrada Margedu Sasnekam Edu Virachanam. See, Atha Anilaja Unmade. Anilaja Unmada means Madhigo Unmada. Snehapanam Prayojayir. Give medicated ghee internally. My dear friends, according to Ayurveda, medicated Grida Kalpana, ghee, are the primary choices in treating Manasika Roga. You know, when we see the clinical benefits of the ghee, it is mentioned beautifully. Dhi Dridi Smriti Meda Agni Kamshinam Shasyade Gridam. Dear resource persons, Dhi Dridi Smriti Meda Agni Kamshinam Shasyade Gridam. If you want to empower the Dhi, intelligence, Dridi, the power of execution, and Smriti, the memory, and Agni, the biological fire, you please take medicated Grida. That is what Ayurveda is telling. Atha Anilaja Unmade Snehavanam Prayojaye Urvam Avrita Margedu. If there is an Avarana in Manovahasrodas, do Shodhana, which can be Vamana or Virechana. Kapaja Unmada Vamana, Pittaja Unmada Virechana, Adigo Unmada Vasti, if there is a Avarana. What do you mean by Avarana? Avarano Margasya Rodha. In the Manovahasrodhas, in the mental domain, if there is a psychological obstruction by Tamoguna, Rajoguna to the Sattoguna, then it is Avarana. I know how to live if I am normally having my Sattoguna, because Sattva is the balance detector. If I am going to Raja, I will be hyperactive. If I am going to Tama, I will be hypoactive. I think you are feeling. The Raja will go for hyperactivity, Tama will go for hypoactivity. Raja will be more Dikshna and Tama will be more Manda, and Sattva is the central point which is detecting how much I should be my normalcy. So when there is an Avarana to the Manovahasrodhas, you need Shodhana Chikitsa. The modern research has shown that the neurotransmitter level, etc., can be influenced by biological purification like Vamana, Vijnana, Nasya. So, in my place, Kerala, when we are getting such schizophrenia patients, the primary thing is we will first educate the family and the patient we will try to do. Then we will start Snehapana, medical administration of ghee internally, after closely watching the Agni status. After closely watching the digestive capacity, the metabolic power, we will give a medicated Grida. The commonest example of the ghee is Kalyanaga Grida. If you open the chapter of Udmata Chikitsa, you can see a wonder drug called Kalyanaga Gridam. Amedasis Kalatvadis Pradhigame Alpa Pavage Velyam Mangalyam Ayushyam Kandi Saukagya Pustidam Kalyanaga Gridam. So Kalyanaga Grida, which is prepared with a very good proven antipsychotic drugs in Ayurveda, and this Grida is given internally in increased order, that is called Snehapana. And after Snehapana, we will do mild Svedana sedation therapy. Then according to the status of the patient with strength and stamina and age, we will select either Vamana or Vijnana. After these two, there is mandatory to do Nasya Karma. Nasya Karma is very much important to control the sensory perception. Kanonada Prasannato Skanda Grivasya Vashasaha, Drida Indriyastu Apalido, Avayur Nasya Shilina, Drida Indriya. You know, the hallucination, the delusion, everything is due to the proper application of Indriyas when affected. Indriya Pradoshaja Vyadis can lead to hallucination. When I am hearing a sound which is not there, there is a problem with the Mana and Indriya. When I am seeing something which is not really there, there is a problem with the Mana and Indriya. So Nasya can correct that problem at this axis. Indriyas to Apelida. So Nasya Karma, we generally give Anutaila in Kapaja condition, Shirabella Avarti in Pitaja condition, and Thanundaram Taila in Vada related conditions. So there are different Nasya yogas depending upon the, you know, the nasal epithelial cells are communicating with the ear, that is Eustachian tube, eye, nasolacrimal duct, and olfactory filaments nose to brain. So there is a proven communication that is called Sringadaga Marma in Ayurveda, very much applicable in modern medical science. So start Snehapana by Kalyanaga Grida, then go to the Sodhana by preferably Vamana Vijnana, then Nasya. This is the main Sodhana protocol. Then we will be thinking about the Murdini Tailam. Murdini Tailam, Abhyanga, Sega, Piju, Vasti. There are four. Shiro Abhyanga, Shiro Vasti, Shiro Piju, and Shiro Dhara, and that will be mainly done by Taila. Narayana Tailam, Shirabala Tailam, Karpasasthyadi Tailam, Chandanadi Tailam, and Himasagara Tailam, etc. are the Tailas depending upon the dosha vikalpa. You can select the Taila after clearly assessing the fractional distribution of involved doshas in the Sampradaya. I always tell Doshanam, Samvedanam, Vigalpo, Amshamsha Kalpana. So do the Shiro Dhara, do the Shiro Vasti, etc. Then you can think about the treatments like Medhya Rasayanam. In Ayurveda, there is a concept called Medhya Rasayanam. Medhya Rasayanam means the Rasayanas which will empower the brain. Shankapushpi Rasayana, Manduka Parni Rasayana, Dhamma Rasayana, and there are Eshti Madhu Rasayana. So any one of the Medhya Rasayana will be given as Rasayana, and these are the medical management of Vadigonmada which can be adopted to schizophrenia as per classical clinical Ayurveda. I am repeating, these are the Shodhana, Shamana, Rasayana protocol for schizophrenia which is totally derived from the basic concept of Udmada Chikitsa. The main Grdas we select are the Kalyanaka Grda. If there is hyperactivity, Kalyana Grda. If there is hypoactivity, Brahmi Grda. Because Brahmi Grda is Tikshna. Kalyana Grda will control the Vata Pitta activity. If there is lack of sleep, insomnia related problem, again we will give a Kalyana Grda 15 gram with Ashwagandha Churna 5 gram together. And this will be given as a combination in my clinical experience. 15 gram Kalyana Grda with 5 gram Ashwagandha Churna is a very, very successful prescription in mental conditions with insomnia. Then definitely you need Sattva-Vajaya Chikilsa, Deva Vyapasraya Chikilsa also. What is Sattva-Vajaya Chikilsa? Sattva-Vajayo Nama Adivebhyo Ardebhyo Mano Vinigraha. You always tell the patient and patient's relative to keep him calm by avoiding the precipitating, aggravating incidents. The patient should not go to the aggressive incident or mental trauma, emotional trauma. So try to avoid all these things. Okay, so I have totally covered the area in a simple way. The concept of Manasika Roga in Ayurveda, it is Rajastamo Dushti. And there is a beautiful reason told by Charaga for Manasika Roga. That also I will tell before I leave. Manasam punarishtasya alabhad labhacha anishtasya upajayade. I think there is no better definition in the current scenario. Manasam punarishtasya alabhad labhacha anishtasya upajayade. What is the meaning? I am very much interested to something, I am not getting it. I will get mental disease. I don't want something, the same thing only comes to me. Again, I will get mental disease. Are you getting me? Are you getting me? Manasam punaha ishtasya alabha. I am very much interested to get a lottery. I am not getting. I want to become the Prime Minister of India. I cannot become the Prime Minister. And I don't want to become this particular person. I don't want to get this post. The same post only getting to me. Then this is the balance. This is the problem. Ishtasya alabhad and labha chanishtasya. Let us salute Charaga Sutrasthana Tisreshaniyam chapter 30. Charaga Samhita Sutrasthana 13th chapter 1-3. Tisreshaniyam, he is defining Manasa Roga by the above statement. Manasam punaha ishtasya alabhad labha chanishtasya vajayade. So what we have to advise the public? You control your desire, control your emotion. That is what Lord Buddha told. That is Lord Buddha told, Aniyaya Pradipagam Sarvadharmeshu Madhyamam. Cannot be so greedy. It doesn't mean that you tell that I don't want anything. You should be in a very proper, controlled way with your Dhi, Dhriti, Smriti. So your emotions, everything will be controlled. Then you may not be getting the mental disease. So Unmada is the psychotic umbrella in Ayurveda. Vadigonmada schizophrenia runs parallel, and clinical features of Unmada and schizophrenia shares common quality, and treatment of Unmada is by Snehana, Svedana, Shodana, Samana, Rasayana, and Adrivya Chikitsa. Adrivya Chikitsa means Sattva Vajaya, empowering the mind, counseling, social support, education, everything we have to do. We have to do the puja, we have to do the rituals, we have to strengthen the mind, the mantras. Manyade, Trayade, Mana, Anena iti mantra. Mantras will support the mind. The acharas, the tirthayatra, the prayaschitta, the puja, everything which we are giving will be supporting the mind, and they will slowly come back to the sattva guna if they are deviated to Raja and Tama. So Deva Vyavasraya Chikitsa, Sattva Vajaya Chikitsa, Vikti Vyavasraya Chikitsa, everything are to be combined. And I am concluding, finally, there is a sentence told by Vagbada in Jora Chikitsa, which is applicable to Unmada. That is my last sentence. In Jora Chikitsa, he is telling, Karunardram Manashuddham Sarvajjara Vinashanam. That is the palliative care. No, nowadays we do palliative care. Ayurveda also mentioned about the palliative care. He is telling it in Jora Chikitsa, in the first chapter of Chikitsasana by Vagbada. He is telling, Joragalas Mridim Chasya Aripur Vishayir Hare Karunardram Manashuddham Sarvajjara Vinashanam. What is the meaning? You always keep the patient away from the feeling of his illness. Patient should not feel that I am ill, I am mentally suffering, I am having some problem, everybody avoiding me, I am alone, I am left alone. Such a feeling should not be there. Aripur Vishayir Hare. You should always engage the patient in the present incident Never tell him to go to the unwanted incident, because karunardram manashuddham sarvajvara vinashanam. If the mind is ardra, if the mind is so thin with the feeling of love and emotion, sarvajvara vinashanam, that is the last medicine. There is no need of any dhara, there is no need of any rasayana, there is no need of any sleeping pill. If you can really provide the ardrada, the sneha, the care from the heart, definitely that is the best medicine. I am saluting Bagbada to tell such a wonderful medicine centuries back. Even now we have every pharmacological products, but there is one product which is not produced in a factory, that is love, that is care, that is cure. That is told by Ayurveda, Karunardram Manashuddham Sarvajvara Vinashanam. So let every one of us be so kind to the patient. Let every one of us be so kind, and by which they will identify that somebody is protecting them, somebody is caring them. Ayurveda is a science which always propagates universal love. Ayurveda tells, Atmava Satadam Pashyeda Kida Pipiliga. You consider Kida, Pipiliga equal to you. No, Lord, Christ is telling that the neighbor is equal to you. Everybody is equal to you. All the religions are telling everybody are equal. Socialism is telling everybody is equal. But Ayurveda told before that, you consider even the smallest creature equal to you. Ashtanga Hridayam, Sutrasthanam, 2nd chapter, Dinacharya, Satvritam. Atmavat Sadadam Pashyedavi Ida Pipiligam. So my conclusion, give support to all patients. The message itself is support to schizophrenia. Let us give all our personal mental care to the patients who are suffering from schizophrenia, and by which the sneha from the heart and snehapana from the pharmacy, both are the outcome. I am concluding, the sneha from the heart and snehapana from the pharmacy, Kalyana Garda Snegavana, both we need. So that is our duty. I am very much thankful to the entire organizers for arranging such a wonderful webinar and giving me a chance. My final conclusion is, learn Ayurveda, love Ayurveda, live Ayurveda. Thank you very much. Namaste.
Thank you, sir. Thank you for a wonderful session.
Excellent, doctor, excellent.
Wonderful, amazing.
No doubt. बहुत सुंदर. आपसे मैं आपको फिर तकलीफ देता रहूंगा, नाराज मत होइएगा. मैं आपको कभी कभी तकलीफ देता रहूंगा.
कोई तकलीफ नहीं है सर, कोई तकलीफ का मामला ही नहीं. हमारे पास जो टाइम पे हम देंगे, हम आपके साथ होंगे. इधर तो हमारा कोविड हॉस्पिटल है, उसका भी चार्ज हमारे लिए है, इसलिए थोड़ा बिजी है.
Thank you, sir. Thanks a lot. We have learned a beautiful session from Dr. S. Gopakumar, sir. Sir have beautifully explained the body-mind connection and something which is called the beyond the body-mind connection. And sir, I have a question to you, that if some spiritual persons who is beyond the Sukha and the Dukkha, so can you consider them as a Unmada Rogi?
Yes, applicable. They are also applicable. Multi-dimensional approaches are there. What I told is the Ayurvedic angle from Unmada Chikitsa. Definitely, there are more other areas which can also be considered and practically used. No doubt.
Okay, thank you, sir. I have another question from my personal experience, from my clinical experience. Sir, I am a practitioner, and lots of practitioners all over the India who are doing the OP-based practice.
Louder.
So, all over the India, we have the OP-based practice. We have only the clinic and the pharmacy. We don't have any kind of Panchakarma facility. In that case, we are giving the Ghritam like the Mahakalyanaka Ghritam, Kalyanaka Ghritam, Paishachika Ghritam, Manasa Gutika, Kalyanaka Kashayam. Those medicine we are using. But we get the result when we are doing the Panchakarma therapies like the Snehapana in proper way. So what's the solution? What's the in between solution to control those patients who are not ready to take the Shodhana therapy? Because when I am advising the patient that you have to take Ghritam 15 ml, next day 20, next day 30 ml, next day 60 ml, it's very difficult to convince a patient in OP level. So what's the solution?
That is very important. In such cases, you can go for only Vijarana Snehapana, and you can even do Sadhya Sneha, but that needs a long duration. It is not easy to treat a mental patient compared to a physically ill patient. It is difference is there. So they may not be able to consume the ghee in higher quantity. What you told is a very, very natural phenomenon. In such cases, we can only do Vijnana Snekapana for a longer duration, or you can give this Grudha, etc. mixed with the food for a long time, that is Sadhya Sneka, etc. So these are the solution. And then you need not think about a Shodhana by Achabana. You can do Vijnana Snekapana, then you can go for a Shodhana. It is always different to implement Shodhana protocol in mental patient compared to a physical patient. What he told is absolutely right, but we can have a compromise. We can have a compromise with the time and we can go for other treatments. And Shodhana is not the ultimate answer also. You can think about the Medhi Rasayana. In my experience, Shridabala Thaila internally, Madhishyadi Thaila internally, Shri Madhu Churna internally, etc. are also showing benefits with the proper psychosocial support. Combine every aspect to the mental patient, forget the theory as such, make the theory flexible. The theories are not rigid components. Make the theory flexible to be applied for a patient who is seriously ill, because every patient will not be learning Ayurveda and coming to us. We only learn BAMS. Patient doesn't learn BAMS. So they might be having some different approach. So it is our intelligence, our experience, our patience to make them follow our therapy even with the maximum effort. That is the real thing which we have to do in practice.
May I ask some small question?
Yes,
Sir, it is a very foolish question. High blood pressure for long time may lead to schizophrenia?
What, sir?
High blood pressure.
High blood pressure, okay.
For long time may lead to Unmad?
No, sir. High blood pressure cannot lead to Unmada, but the Unmada may aggravate the BP. If there is emotional fluctuation, the BP may go beyond control. High blood pressure cannot lead to Unmada, but Unmada may get some action on the high blood pressure. Unmada means emotional frustration, anxiety, etc. can trigger your BP. That is better. In such conditions, sir, we do Takradara. Takradara means medicated buttermilk will be used as dhara. That is good for psychosis and controlling BP.
Thank you, sir. Thank you.
Thank you, sir. Thank you so much.
Is there anybody have any question? Is there anybody have any question?
No, question answer can be asked in the last. Please continue the lecture.
Okay. Thank you, sir. Thanks a lot for
Excellent, Dr. Gopakumar.
enlightening us. And
Thank you,
the
sir.
last
Thank you.
the
I have
last
some more meeting. We will meet again.
Okay, thank you, sir. Thank you, sir. Okay, so sir has beautifully explained his opinion and he has enlightened us. Now we have another speaker, Dr. Suhas Kumar Shetty, sir. He is the professor and head of the department of Vijnana Manasa Roga, Dean, and she is a professor of SDM College, HASSAN, and Sir is a practitioner, teacher, researcher, and who has specialized in mental health and research methodology and medical statistics. And Sir has achieved so many awards around the globe, and Sir beautifully speaks his words around the globe, mainly in USA, England, Scotland, South Africa, Sri Lanka, and various parts of the India. And in this occasion, I would like to invite Dr. Suhas Kumar Shetty sir to share his valuable experience and enlightening us.
Welcome, Dr. Suhas Kumar Shetty. Welcome.
Thank you, sir. Thank you. I'm really obliged by your invitation and the love that you poured in. I think probably within 2 weeks, I'm meeting again for the second time. Thankful to the entire team.
I'm grateful.
I'm obliged, sir. I think we have heard to a wonderful presentation and a talk by the very versatile Gopakumar sir, and he has talked about the basic concepts, principles about schizophrenia and Unmada. And basically, as a practitioner, practitioner of Manasa Roga, I'll try to add few more things as a practitioner, share my clinical experiences of treating the major mental disorders, especially talking about the schizophrenia. So I'll just share my slides and The slides are visible, sir? Pawan, sir?
Not yet, sir.
Yes,
Yeah.
yes, please, sir.
Yes. So once again, a very warm welcome to you all. I thank the Independent Research Ethics Society and ZANDU Imami and Ayush Darpan and Vishwa and Parishad for this wonderful opportunity to share my clinical experience in the field of Manasa Roga. And as you all know, today happens to be the World Schizophrenia Day because all these are specially celebrated or organized to create an awareness among the people about these diseases. Because there are a lot of misconceptions, a lot of wrong, false information about the people about these conditions. So, what are the available opportunities that is there for the treatment? Why this management is very important, and what Ayurveda has to offer? This is a very good platform that has been created under the supervision of Dr. Pawanji, and I'm very thankful to him for his wonderful opportunities. And I think without taking much, probably I'll just try to share my experiences, the understanding and management of schizophrenia in Ayurveda. So as I said, being a practitioner, probably I'll start my presentation with one case report, with a case study. See, a case study on, generally we get a lot of patients, dosha unmada or nija unmada, but I'll just start with a very unique case of a bhutolmada, okay, or what is also called as agnostic unmada. So this is a 30-year-old male who was unemployed graduate hailing from Kottayam, Kerala, and the informant was both patient as well as the mother. The main complaint of the patient, as per the patient, was he was having nausea and vomiting. But as per the patient's mother, he was suffering or he was complaining of sudden irritability, agitation, indifferent behavior, hearing sounds in the ears, seeing the objects in front of the ears, and always he is trying to talk to himself and looking around since last 8 months. The patient had lost his father when he was very young at the age of 1.5 years. And since then, he has been always arguing and always been fighting with the parents to see what could be the possible reason for condition. If you look for the examination of patients, patient was cooperative, but the patient didn't have the eye-to-eye contact, and patient was agitated and aggressive many times. Memory was intact, the thoughts were intact, but the perception, especially the patient has a auditory as well as gustatory hallucination. Because of that, patient was that he was not feeling the taste, he was not getting, and he was feeling nausea and vomiting. And other, it was said to be normal. So the diagnosis of this patient was the patient was suffering with the delusional disorder, and the treatment in Ayurveda, because when you are not able to understand the exact cause, and this is a sudden onset of the disease with any no detectable cause, put under the category of Gopakumar. The treatment that was planned for this patient was the combination of Pasha and Sattvaja. Initially, we started with the Shamanoshati of Sastarishta, 25 ml twice daily, and Kalyanaka Girta 10 ml twice daily before food, and Manasa 22 to beat. Patient was advised for Takratara because patient was complaining of reduced sleep, and then the patient was started with RO Dept. In this patient, we started with, because patient has hallucinations, delusion, we started with Kalyanaka Panchagavya Girta, and because patient had good appetite, we had to give the Snehapana in 2 times. See, people generally think that whether they take the Snehapana in patients of Unmala or psychiatric patients. In fact, they are very, very cooperative when they get the benefits. And as that is like Prabhuta Snehapana is advised, because there is Prabhuta Dosha Uttesha is present. So that is where the patient should be given a Prabhuta Snehapana. And in this patient, we gave for 6 days. And the last day, we gave up to around 500 to 600 ml of the Panchagavya Girtas, followed by Abhyanga for 2 days, and then the Virechana using Trivatleha. The patient had 10 Vegas, followed by the Snehapana. So after Snehapana, patient was having normal mood. So again, sometimes if the mood is less, the patient again can be given some stimulant, like I can give the Gudanagara Rasya for 3 days. We started with two drops and then increasing the 2 drops every day. And after that, we used to give the Shamanaushadis, like we give the patient with Unmada Gajikesara Rasa 2 BD. So there is one beautiful combination, especially which you can use for delusions, hallucinations, and many patients of psychotic disorders, delusional schizophrenia. Whenever a patient has any hallucinations, delusions, one of the best combination which is generally practiced, and not only here but also in the Kottakkal Mental Hospital, also they practice this of using this special compound, which is a combination of Shankapushpi, Gokshura, and Sarpagandha, like 50 grams of Shankapushpi, 50 grams of Gokshura, and 30 grams of Sarpagandha. We give 1 or 2 teaspoons twice or thrice a day. Sometimes what we do is we give 1 teaspoon in the morning and 2 teaspoons in the night, and you get very good results with this. This is a very good combination for patients suffering with schizophrenia, especially having hallucinations and delusions and other psychotic disorders. You can also use Talapodichil using Kachuradi Churna and Shirabala Theras. So what was the patient's outcome? So when the patient was again assessed after 15 days, the hygiene of the patient increased, the eye got better, agitation was reduced. Most importantly, the patients, because we feel that patients, we used to say that most of his toxins has been removed of patients, vomiting and nausea has stopped, the self-talk and the self-love has reduced, the self-care has increased, and the patient roaming around has been stopped, and patient started to listen to the commands. And patient was also taking ganja and other smoking, which he stopped after 15 days. And the patient was also followed sufficiently for 6 months. He used to come to the OPD for 6 months for every 15 days, because that is very, very important. The patient was getting much, and with very minimal medicines, patient is still doing better. So this is what is a very big background, saying that the mental health and psychiatry is a very, very important aspect. And that is why probably Acharya has given this among the status of one among the Ashtangas. What's mental illness? See, mental illness is a general term for the mental disorders caused due to either brain dysfunction, resulting in the disturbances in the thought, perception, emotion, and the behavior. And what is important is how to identify these different types of mental illnesses. See, most often there are no X-rays, there are no any laboratory investigations which helps a clinician to diagnose patients of mental disorders. It is by history, observation, examination, which is very, very important. So in this, there are many types of common psychiatric disorders which you come across in the clinical practice, like schizophrenia, major depression, substance abuse, sleep disorders, anxiety disorders, eating disorders, childhood disorders, old age disorders like dementia, etc. But in today's session, because this today being World Schizophrenia Day, we're going to discuss about schizophrenia. So I think there are plenty of people who have been suffering with schizophrenia. There are a lot of movies, a lot of dramas which has been picturized on schizophrenia. This is one such a very famous movie called as A Beautiful Mind, which is picturized on a schizophrenic patient. See, basically schizophrenia is the most common severe mental disorders, like sometimes like mild to moderate type of depression, anxiety, insomnia, you call it as something called as minor mental disorders. But when it talks about schizophrenia, bipolar disorders, delusional disorders, schizoaffective disorders, they're all something called as coming under the category of major mental disorders or severe mental disorders. See, people suffering with schizophrenia is around 1% of the population. That is more than 65% of different degrees of schizophrenia are suffering. And what is most important, especially in schizophrenia, is the young people aged between 25 to 35 years are suffering with schizophrenia. And it is equal among the male and female. Very commonly, what are the symptoms patient will complain about? Hallucinations. See, how will you assess hallucination in the patient? Patient will not directly tell that I'm having hallucination. Patient will say that I'm hearing somebody talking to me. I'm seeing somebody running in front of me. And if you ask anybody else is also saying that, the patient will say no. Okay. And sometimes if we have to cross-check with how the patient behaves in the home, how patient is behaving in the office. That is how you can always, and that is what the most common hallucination that you see in schizophrenia is the auditory hallucination followed by visual hallucination. Especially the patient will have the fear, somebody is going to kill me. So that is why the patient will not take food properly, thinking that somebody has added poison to the patients. And this is what is the persecutory delusions, very commonly seen in the paranoid delusions. There could be so many types of religious delusions. People will be very much attached towards prayers, gods, worshipping. It is very, very commonly seen. People also feel that somebody is trying to control their thoughts, control their mind, control them, and they will have the delusions of control. Patient, two people are talking, and suppose I'm standing here, and suppose two people are talking, I'll always feel that they're talking about me. Or people will always complain that my neighbor is always shouting at me. Neighbor is always complaining at me. Because people are trying to spy me. So this is a very, very, and this is something very, very serious. Because the psychiatric patients sometimes can cause a lot of difficulties for the bystanders also. That is why identifying them, getting the proper treatment at a very initial stage is very, very important. Because if you don't give the treatment properly, by any mode of the therapies, maybe Ayurveda or allopathy, any form of treatment, if they are not properly diagnosed and managed, probably they can end up with a lot of trouble in the futures. Most importantly, they will have a lot of irregular, disorganized thoughts, irrelevant thoughts, and most often they will have disorganized speech, disorganized behavior, etc. And see, there are two types of symptoms which come across in case of schizophrenia: the positive symptoms and the negative symptoms. The positive symptoms, what is called as hallucinations and delusions. The negative symptoms includes the social withdrawal, lack of physical activities, lack of facial expression, the neglect of the hygiene, and the lack of motivation, etc. And this is what commonly we can see, and this is called as the epiphrenic schizophrenia, which we commonly come across in the undifferentiated residual type of the schizophrenia, which is commonly seen. See, and very commonly, probably the first line of treatment before going to the doctors or a psychiatrist or mental health professionals, especially in cultural situation or religious situation like India, people go to mantravadis or the black magic or go to temples before they are brought to the. And there are a lot of people who are believing in this. And that is where probably it is about the belief of the people. Especially if you look for the population of the rural areas, definitely they would have definitely approached a temple or a black magician before they come to the see. And I generally, whenever a patient says that whether I can go there or not, see, it all depends upon the patient. I never deny not to go because it is their belief, it is their trust which can add to their cure. If they have the trust, probably it adds to their benefits. See, what happens in case of schizophrenia? See, schizophrenia is like there could be family history of the mental disorders in the family, and especially there are various types of environmental, social, and psychological factors like death of a near one, loss of a job, or moving to a new place. The patient is not able to manage the stress. There are pre-morbid personalities. And so that is why there are a lot of the changes happening inside the brain in the chemicals, especially the dopamine, serotonin, GABA receptors. There's a huge imbalance, like we said. See, basically, how do you understand these neurotransmitters in Ayurveda? It is the abnormalities of Rajas and Tamas. Rajas is excitatory neurotransmitters, and Tamas are the inhibitory neurotransmitters. And whenever there is an imbalance of Rajas and Tamas, or the excitatory and the inhibitory neurotransmitters, a person will have brain dysfunction, improper balance of the chemicals, leading to schizophrenia. See, especially the temporal lobe and the parietal lobe are important for the development of the positive symptoms, whereas the frontal lobe is important for developing the negative symptoms. This is very, very important, and that is where you can see the nasya, dhara, they are all very, very beneficial in reducing the positive and the negative symptoms. And there are different types of schizophrenia, starting from paranoid schizophrenia, epiphrenic schizophrenia. So there's something called as catatonic schizophrenia, which is something like paranoid can be Vasaja Unmada, epiphrenic can be Pittaja Unmada, and catatonic, especially the silent type of catatonia, can be the Kaphaja Unmadas. And there can be so many types of other residual or unspecified type of schizophrenia. How do you manage these cases of schizophrenia in the modern science? See, there are three stages to which patient can come to you. One is very acute stage, initial presentation, which is generally for 4 to 8 weeks, which will have acute psychotic episode. And there is something called as stabilizing. Gradually, patient is getting settled down, and it's called as early symptom remission, which can continue or last for 3 months. Then something called as maintenance dose or the stable phase, which involves stable treatment. These are the 3 types of the stages that we should always diagnose the patients of a schizophrenia, whether they are in the acute phase, stabilizing phase, or stable phase. Initial psychotic features, early symptom remission, or maintenance conditions. So, what are the different types of the medicines that are available? The most important and extensively used medications for schizophrenia are the antipsychotics. See, these antipsychotics are a wonderful group of drugs which are used, especially for the management of the severe psychotic disorders, especially the positive symptoms like hallucinations, delusions, work wonderfully well with the help of modern drugs. See, okay, we cannot deny the effect that we can get in the clinical practice. Okay, so but especially for the negative symptoms, Ayurveda, yoga, meditation can play a major role. A few short period of time, maybe for 2 to 4 weeks or 6 to 8 weeks, you can use this antipsychotics. You can reduce the patient's symptoms of positive symptoms, and then probably add on with the Ayurvedic treatments. And that is where probably there are 2 types of the antipsychotics, the typical antipsychotics and the atypical antipsychotics. The typical antipsychotics were the earlier period which were used for a lot of side effects. But in case of the second generation antipsychotics, which are the newer generation antipsychotics like clonazepam or olanzapine, risperidone, qutipine, etc., which are said to be safer type of drugs. But yes, if the patient is taking this medication for a very longer time, before 6 years, 8 years, etc., they can have a lot of side effects like constipation, tremors, loss of appetite, sexual dysfunctions, lack of sleep, and that is where something called as treatment-resistant schizophrenia. So we have treated many patients of a treatment-resistant schizophrenia, where you have to start with Vipanapachana, Shodhana, Shamana, Rasayana, coupled with the Sattvaja Chikitsa. Vipanapachana, Shodhana, Shamana, Rasayana, along with the Sattvaja Chikitsa. And sometimes when the patient are having very severe symptoms, they also need to be hospitalized. And that is why I am saying, along with, but whenever they are having acute symptoms, I think the psychotherapies of Sattvaja are not the first line of treatment. That's the reason why Sattvaja is not mentioned as a first line of treatment in Unmada. Especially they have mentioned about the Yuktyopasha Chikitsa, followed by Devapasha Chikitsa, Adravibhuta Chikitsa, and lastly, when a patient will regain the normal buddhi, then only the patient has advised with the Sattvaja Chikitsa. So there are different types of individual psychotherapies, social skill training, family therapies, vocational rehabilitation. And see, there is one more very important therapies or treatment which people are always sometimes very afraid, because sometimes in movies they show it in a very, very negative way about the shock therapies, or what is commonly called as the electroconvulsive therapies or ECT. In fact, nowadays we use this ECT along with anesthesia, and it's said to be very, very beneficial, especially in case of paranoid schizophrenia. Those patients who do not respond to the pharmacological treatments, treatment-resistant schizophrenia with suicidal thoughts, the ECT, at least around 6 to 10 cycles of ECT work wonderfully well. Okay. And along with that, probably if we can add Ayurvedic treatments and therapies and the herbs, it gives a very good relief. And then you have the cognitive behavioral therapies. So how do you understand schizophrenia in Ayurveda? It is under the umbrella of Unmada. Unmadam punaha mano buddhi sanya jnana smriti bhakti shila cheshta achara vipramam vidyat. So there are 2 types of Unmada, the Nija Unmada and the Agajya Unmadas. See, what is the basic difference? See, this is important for diagnosis and treatment. See, when you are able to diagnose the exact cause of a disease, when you are able to exactly understand the doshas involved, dhatus involved, lakshanas, you are able to do the karyakarana sambandha, then it is called as dosha Unmadas. For which you can use the Yuktyopasha Chikitsa. But if you are not able to identify the doshas involved, not able to understand what is the exact cause of a disease, you then you have to call it as the Bhutonmada. That's a basic difference. Based on the cause and based on the parameters like dosha and dhatus and Agni, if you are not able to diagnose it, you should put under the category of the Bhutonmadas, where you should treat with the help of Daivaparsha Chikitsa and the Sattva-Vajra line of treatment. So this is what the Yuktyoparsha line of treatment is the first line of treatment for Doshonmada, and Bhutonmada you can go with the Daivaparsha Chikitsa. And for both the conditions you have to manage with Sattva-Vajra and Adravabhuta Chikitsa. See, there are, how to understand these Bhutonmadas or the Bhuta Vidyas? There are different types of external causes like the Abhichara, Abhishapa, Abhishanga, and they are said to be the cause for the mental disorders. Because the Agantu is of two types. Just as Charika doshas are of two types, Agantu is also of two types, Sharira and Manasa, as told in Charaka Sutrastra. So, how do you understand the Sharirika Agantu Vyadhis? When it is caused because of Abhigata, Visha, Agni, Samprara, etc. It can lead to the Sharirika Agantu Vyadhis. It is because of the Mano Abhigata, Abhishapa, Abhishanga, Visha, etc. It is coming under the category of a Manasa Agantu Vyadhis. That is why understanding the concept of the Agni, the concept of Ojas becomes very, very important. So, Deepana Pachana, Ojo Vardaka, Rasayana line of treatment are said to be more beneficial for management of schizophrenia and Unmada line of treatment. So there are so many causes which I think Dr. Gopakumar has highlighted, and the most important thing is Istasya Alabhat, Labhat Chanistasya. There are so many factors. See, schizophrenia is a multifactorial disease. There is hereditary disease, there is social factors, there is psychological stress factors, and there are some physical disease also which can lead to psychological. And so there are different types of aharaja, viharaja, and manasika karanas which can lead to various types of mental disorders. Especially when it comes to the agantuja unmada, it is because of the external factors like the abhishara, abhishanga, etc., which is said to be the major cause. See, if you come to the etiological differences between the Nija and agantuja unmadas, it is because of the food, the exact doshic involvement, prajnaparada is being cause for Nija Unmada, and it is unknown. Especially, but still there is prajnaparada, which is the primary etiological factors of Agantuja Unmadas. There are combination of the manovega, the Vishama Cheshta, Visha Prayoga, Dhi Dhairya, Atmadi Vijnana, Dhi Dhriti Smriti Vipramsha. All these combinedly will cause the mental disorders in Unmada. Especially the Alpa Sattva. Alpa Sattva is said to be the main cause for the manifestation of Unmada. Especially how do you identify Nija and Agantuja Unmadas? In case of Agantuja, there will be abrupt specific situation and dominated will be psychological symptoms. Whereas in case of Nija, it will be more of a physical symptoms which will be present. It will be gradual in nature. See, there is nothing which is going to enter inside the body. Ayurveda, both Charaka and Shushta, really mentions that no Bhuta, no Deva, no Gandharva is going to enter inside the body. It is just the mind, the attitude. That's the reason why even during the COVID also, probably more than the disease, probably it is a mindset which will make a person to suffer with various types of viral diseases. So there's a beautiful simile which Shushruta says, it is like as if a person is seeing the mirror. Okay? As if image enters inside the mirror. Similarly, the emotional disturbances happens inside the person, and the person will have the emotional disturbances. And there are three major causes why the Agantuja Unmada a person will suffer. It is because of the himsa, rati, and abhyarcha. And there are, you can also understand this as encephalopathies, you can understand this as various schizophrenia, the personality disorders, you can understand in terms of the microorganisms in case of the Agantuja. So Lakshana as already has been mentioned. And coming to the treatment of this Unmada, especially for Agantuja Unmada, it's mainly the Snehapana and the Mantradi Prayoga or the Devarpasha line of treatment, which is the main line of treatment. And for Nija Unmada, it is the Vichapasha, which is said to be the main line of treatment. And there are different types of the treatment. So you can always understand or give the treatment based on the types of the doshas involved. If it is Vata dosha Unmada or Vataja Unmada, the best Shamanaushadis or the Grita Prayogas are Kalyanaka Grita and Mahakalyanaka. If it is the Pitta Anubandha Lakshanas are there, a very lot of agitation, aggressive, then Avipattika Churna. Along with that, you can use the Kushmanda Grita and the Brahmi Grita. And if it is Kafaja Lakshanas are dominant in Unmada, then Panchagavya and Mahapanchagavya Gritas are to be beneficial. For Vata, you can go with Kalyanaka and Mahakalyanaka. For Pitta, you can go with the Kushmanda and the Brahmi Grita. And Kapha Unmada, you can go with the Panchagavya and the Mahapanchagavya. Should give a combination of the Devapasha, Yuktyopasha and the Sattvaja Chikitsa. See, basically, Devapasha Chikitsa is based on the different faith-based therapies. Maybe like mantra, mani, prayashchitta, gamana, swasthayana, etc. Where it is more based on the faith of a person. And Yuktyopasha is where you can use the various types of Parimarjana and Antaparimarjana line of treatment. And commonly we practice different therapies like a Mridushodhana, could be Vamana, Virechana, Basti, Murdi Tailas, all like Pichu, Seka, and other Basti. And Nasya is very, very beneficial when there is hallucinations and delusions. You can use Panchagavya, Mahapanchagavya, Purana Gita Nasya is said to be very, very beneficial. We give both internally as well as we give the external management using the Purana Gritas. Every year we prepare around 5 kgs of Grita, keep it for 1 year, and then we use for our practice in cases of in our hospital. Anjana, like Shirishadi Anjana, Dharma Anjana, Manashiladi Anjana, should be beneficial. Then Dhupana or Dhumapana is also beneficial, like Haridra Dhupana, Manashiladi Dhupana, and especially if it is chronic schizophrenia. After you do Vamana or Virechana, if you do the Mustad Yapana Basti or Gudicha Yapana Basti, Raja Yapana Basti is said to be very, very beneficial. Basti in case of chronic schizophrenia is said to be very, very beneficial after you do the initial kind of treatment using the Shamana or the Shodhana. See how it will act, Vamana, Virechana, Basti, Nasya, etc. It is going to cleanse the Shiras, Hridaya and Indriya and Koshta. See, it is like the Adhara Adaya Bhava. It's a beautiful simile in case of Ashtanga Hridaya. In case of Hridaya Avbodhini Tika, it says that Taptacha Gateriva. It's like a pot and the ghee. If the ghee is hot, it will make the pot also hot. And if the pot is hot, it will make the ghee also hot. So, Echa Vikaraha Paraspar Anuvartamanaha Kadachit Anubadhanti Kamadayo Juradayascha. Saptamcha Seriam Anuvidhiyate. They're always interrelated, either in case of the health, disease, or management. And that is how we're able to treat this body, also cleanse the mind. And there are various good number of Shamanaushadis, single drugs, like Jyotishmati, Shankapushpi, Guduchi, which are good Medyas, Kushmanda, Ashwagandha, good Balya. And especially when there is aggression, like Sarpagandha, Parasika Yavani, Tetamamsi, Agara, they are good sedative and calming therapies. And suppose you want to have the stimulation, then you can use Vacha. So all these are said to be very, very beneficial. So there are 2 types of therapies which has been mentioned in Unmada, Dravyabhuta and Adravabhuta Chikitsas. And Adravabhuta Chikitsas includes various types of Vismarana, Vismapana, Bhayadarshana, etc. How do you use this? Actually, the Dravyabhutas are the pharmacological treatment and Adravabhuta Chikitsas are the non-pharmacological. Dravyabhuta will affect on the Stula and Sukshma Sharira, and Adravabhuta Chikitsa will have an effect on the Sukshma Sharira. And this can be classified under 2 headings. The positive modalities of treatment, which are Vecha Vedena, and positive modality of treatment, which are Ichha Vedena. See, the negative line of treatments are important for the survival of an individual, whereas for the development and growth, you need the positive therapies. I'll give one example, like how can you use this therapies in a clinical practice, like Bhayadarshana, inducing fear. Like it is indicated in case of the performance anxiety. Like suppose a person has stage fear, you ask the patient to do the practice in front of the mirror, then only a person will be able to come out of this. Or suppose if the patient is having alcohol addiction, you show the patient who has been suffering with liver cirrhosis, ascites, blood vomiting, then this will cause a real fear to the individual. Like in ancient days, it was about inducing by showing the snakes and elephants, but now we can do something called as exposure therapies or the flooding therapies, which we do in our practice. And what we do is we expose them, we take the patient to the ward, show them the patient who are suffering with very chronic type of a mental disorder, especially alcoholic disorders, for the patient who is alcoholic. And this is how you use the exposure therapies for the patients suffering with the addiction therapies. Along with this, one patient gets the buddhi is said to be normal, then his insight is normal, then only you can think of the sattvajana treatment. So sattvajam punaha ahitebhyo arthebhyo manonigraha. So there are the therapies which can be used for regulating the thought process, reframing the ideas, analyzing the presumption, affecting the objectives and the ideas, and helping a person to take the proper guidance and the decisions. See, don't think that mental disorders is something very abnormal, because there are a lot of social stigma. Whenever a patient has this mental disorders, people try to socially isolate such patients. They are also equally normal. So it is not their problem. There are a lot of changes happening inside their body, inside their mind, inside their chemicals, which is a cause for their disease. It is not their problem, it is the problem of the disease which they are manifesting. We have to accept these people, give them care, compassion, then only we can definitely keep the patients. Many big celebrities also have been suffering with mental disorders. They have overcome this and they have been successful in their life. It is okay to take help. If you have a problem, it's see, just as we have problem, suppose we have fever, we have headache or we have back pain, don't we go to a hospital, don't we consult a doctor? Similarly, it is definitely okay to have some mental disorders. Suppose you're not able to manage your stress, it is definitely okay. Talk to your friends, talk to your parents, talk to your teachers, and if at all they are not able to help you, you can definitely contact a mental health professionals. People who are experts in Manasa Roga will definitely help you in coming out of that. And I think, see, very few people are suffering with schizophrenia and severe mental disorders. There are so many types of minor type of mental disorders which can easily be managed without any medicines. 3 to 4 counselings is sufficient for you to manage various types of mild conditions. But yes, a condition like schizophrenia definitely needs a very thought out planning of the therapies, medications, treatments, etc. Okay. So I always say that, especially in mental disorders, it's more than the management, it is a prevention which plays a major role. That too in small children, adolescent, because more than 50% of the children, more than 50% of the mental disorders start before the age of 14. I repeat, more than 50% of the mental disorders like schizophrenia start before the age of 14. So that is why we should take care about our children, we should take care about this young population so that we can identify that problem at a very initial stage and give them proper treatment, therapies, support, love, care, compassion so that it doesn't proceed to a major disorders like schizophrenia. So that is why always I say that ABCD 4321 model to prevent the schizophrenia and mental disorders. What is A? Away from distraction. There are so many distractions, especially in case adolescents, there will be a lot of distractions because they want to try something new. So try have the focus of your life, have the aim of your life and work for that. Proper planning of your life, what you want, what you want to achieve in life. And be happy, enjoy your life, be committed, and do some daily exercise. At least 20 minutes of exercise, 5 days a week is the must to prevent mental disorders. Drink plenty of water, at least 3 to 4 liters of water, 3 times sattvic balanced food, 2 times of small prayer, yoga, meditation, and at least have one recreational activities. Maybe like singing, dancing, going for a movie, going for a picnic, etc. Have one important recreational activities is going to keep you relaxed. Okay. And engage yourself in very good lifestyle modification like meditation, yoga, music, sleep, relaxation, auto-suggestion, etc. And you should do on a regular basis. It's not that you do for 3 days or 3 weeks and you will get everything will be fine. It should be a part of your daily routine. to be part of your daily routine in cases of all these practices. That is why Ashtanga has said is Nityam, Nityam Hita Ahara Vihara Sevi. It is not once or twice. Yeah, you should do it on a regular basis. See, there are a lot of researches which has been done in our institution as well as in various research centers where we have tried to classify these medications based on the different actions. For anxiety disorders, Ashwagandha, Brahmi, Jatavamsa is very good. For depression, Ashwagandha, Vacha, Kapikachu is very good. For sleep inducing, Jyotishmati and Tagara is very good. For sedation, Shankapushpi, Mandukapani is very good. For apasmara, Shankapushpi, Shigru is very good. For neuroleptic, Jyotishpati. For stress, Tulsi, Lashuna, Ashwagandha, it will be very beneficial. For psychotropic, Ashwagandha, Brahmi. For neuroleptic, Ashwagandha. For antipsychotic, I just mentioned about a combination like Shankapushpi, Mandukapani. For Parkinson's disease, Pikachu, etc. I think these are some of the very, very potential drugs which can be used, and many of these drugs can be used very safely or in combination with the modern antipsychotics after performing Sharma or the Chodhari. So to conclude, or I can say that schizophrenia can be understood under the broad heading of Unmada and other psychotic disorders. For Vasaja type of Unmada, go with Mustadi Aparbasti. For Pittaja Unmada, Rechana. Kafaja Unmada, Vamana. Shamana Oshadis for Vasaja is Kalyanakrita. Pittaja is Ushmanakrita. Kafaja is Panchakavrita. And you can use different types of like Ashwagandha, Brahmi capsules. And in the Sattvaja Chikitsa are the inside-oriented or family therapies and the supportive psychotherapies. To conclude, Unmada denotes a general approach towards understanding all the minor and major mental disorders. The whole basis of classifying this Unmada as Nija Unmada and Agudza Unmada is based on the doshas involved, the clinical manifestation and the line of treatment that can be adopted. For Nija Unmada, the Yukva partial line of treatment, and for Agudza Unmada, the Deva partial Chikitsa line of treatment should be. But always these Nija Unmada and Agudza Unmadas also can be interrelated and interconnected, just as the body and mind. So that is why more than the curative management of schizophrenia and other major mental disorders, it is a prevention which Ayurveda can do a lot. Nityam Hita Ahara Vihara Sevi, Samikshakari, Visheshu Asaktaha, Tataha, Samaha, Satyaparaha, Shamavan, Aptopasevicha, Avanti Aroga. The person is regularly intaking the balanced diet, involved in physical activities, very critical in being analytical, being sensory detached. See, nowadays, social distancing, is also very, very important. Being kind, helpful, emotional balance, being truthful, able to forgive people, not having the grudges in the mind, because all these negative thoughts is the main cause for all the things happening inside the body. Keep your body a nice place. So just as we have a nice environment outside, keep your internal environment also clean, with lot of clarity, purity. Yes, so that is why the Atmadi Jnana, Atma, Desha, Kula, Kala, Bala, Shakti, all these are very, very important to maintain the health. So I once again thank the entire team of Pawanji, especially the Independent Ethics Society, and the entire Emami ZANDU, and the Ayush Darpan and the Vishwa and the Parishad for these wonderful opportunities. And if there are any questions, I'll be happy to take up these questions and share my experiences. Thank you.
Excellent, excellent, Doctor, excellent. Very nice aspect. You have explained everything regarding schizophrenia. Before going to question and answer section, I would like to invite Dr. Rishiram Koirala ji, who is here. He has given comment in chat box that mind is also important and Nastiki Chikitsa. What is that Nastiki Chikitsa? I would like to request Dr. Koirala to kindly share his views on that.
Listening me, voice is okay?
Yes, sir.
So I'm from Kathmandu, Nepal. I was
welcome.
basically, I did my MD from PHU under Professor Ramharsa Singh. So
Bhagavatam.
basically there are two phenomena. If I make it as a very summary, Abhyasa and Vairagya. Abhyasa and Vairagya is the very important thing is that we all the time we are doing the Abhyasa, but we do not know how to do the Vairagya. A lot of time people say Abhyasa and Vairagya are two different things. In the Naistika Chikitsa, where the Balavat Karma Sanchaya is there, and how they this is second way to think about the Balavat Karma Sanchaya. Another thing is that we normally, if we are Bhagyavadi and Purusharthavadi, so in the whole our principle, what it says is that we create every moment in a evolutionary Purushartha and Bhagyas. It is not a Bhagyavadi only, where the repetition happens. And another, I used to give a lot of lectures in international forums about the Karma Vipaka. And what's the Buddhist philosophy, what's our Upanishad it says. That's why in that what happened that all the time, a lot of Buddhist philosophers or our Hindu philosophers also think that this is my bhagya. But we create a Purushartha, and it goes as a parallelly in the evolutionary process. When I was delivering lecture in London, then how the mind has to go beyond the mind, and how is the evolutionary process in our old text. Normally teachers are saying is that evolution is a one-time job, but not in Ayurveda. In Ayurveda, evolution is a every moment happening, every time happening. That's why Abhyasa and Vairagya is the best for Nasti Chikitsa. Nice,
sir, nice. We will definitely keep one session on this. Now I would like to go for question answer session. If any question is there, I would like to welcome any question from the audience.
Thank you very much. Thank you.
Thank you, sir. Thank you very much, sir. Please communicate your phone number. I will communicate my daily webinars to you.
I have one question to Dr. Shetty.
Yes.
Yes, sir.
Namaste, sir.
Sometimes you use modern medicine along with Ayurvedic treatment, or you are giving purely on Ayurvedic treatment only. Because sometimes some aggressive patients are also there.
Respected Sharma sir, I think this is a very, very practical question, a very, very good question actually for a practitioner, because what happens whenever you are practicing, people are already coming with so many medications. Okay, and patient will say that I've been taking this modern medication for 5 years or 10 years. I want to stop this modern medication and start iron treatment. Okay, so what you can do for us? See, what happens when a patient is already on this medication for a longer time, it is not a good advice for to stop it once. Okay. So what we do is we do not stop the patient at once. Ask the patient to say that, see, this is what is happening. You have been taking the medication for a longer time, and we have to analyze the patient's condition. And then the most important, especially in case of chronic diseases, is we go for therapies of at least 1 or 2 Panchkama therapies like maybe Vamana, Virechana, Basti, Nasya, etc. And then you see the patient's condition. Gradually, we can reduce the dose of the modern antipsychotics. But in very severe conditions like schizophrenia and all, I think generally we have to keep them on some modern medication for lifelong. And along with that, they can use the medications. But in case some of the patients who are coming for us for the first time and they're having mild to moderate symptoms of anxiety, depression, etc., only with Ayurvedic treatments. Even in case of, I think one of my specialty area is de-addiction, especially the different types of drug addictions. We have a specialized Ayurvedic de-addiction center, 30-bedded hospital in our campus, where we are doing like 90% of the cases we are using the Ayurvedic treatments. Only when there is severe hallucinations, seizures, withdrawal symptoms, which is very severe, then with the help of modern doctor, we are doing the integrative approach. But in 95% of the cases, they're effectively managed with only Ayurvedic therapies and treatments along with the yoga, meditation, etc. I think in case of the chronic diseases, we have to continue taking the modern medications. In case of acute patient coming to us for the first time, definitely we can manage with the line of treatment. Very confidently we can manage.
Yes, yes, you are correct. Yes, thank you, Dr. Shetty.
Thank you, sir. Thanks for a wonderful session. And
I think there are a few more.
Yes,
Dr.
yes.
Arka,
Yes,
there are a
yes.
few questions in the chat box. Can
Yes.
I take this question?
Yes, yes, sir.
Before
Yes,
we
sir.
could
Yes,
conclude?
yes, sir.
Yeah, yeah. See, there is one question which is asked by Dr. Kalyani, who says, please explain about the bipolar disorders and its prognosis in a 17-year-old child.
Yes,
I think
yes.
this is a good question and a very common condition that we come across in the practice. A patient comes with a bipolar disorder. See, basically bipolar disorders you should understand based on the Vata and Kapha type of Unmada. See, bipolar, as you know, there are two poles. There's one pole which is having the mania and the other pole which is depression. So it is an alternative sequence clinical presentation of mania and the depression. So when the patient has mania, you should treat as Vata Pitta Hara line of treatment. And when there is the depressive features, you should treat like Vata Kapha Hara line of treatment. So that is why, for example, you should go with the Virechana in case of manic patients, and in case of depression, you can go with the Vamana line of treatment. So especially if the patient has the manic line of treatment, you can go with Tiktaka Gritas, Kalyanaka Grita, etc. The patient has the depressive, you can go with Kalyanaka, Paishachika, Apara Lashanadi Grita, Vachadi Grita in patients of the depressive features. So the diagnosis of that bipolar should be done as bipolar with mania or bipolar with depression. Bipolar with mania, Vata Pitta Hara line of treatment. Bipolar with depression, Vata Kapha Hara line of treatment should be followed. Line of treatment for OCD. Yeah, see again, this is a very, very challenging cases. It is not easy for you to manage clinically with the obsessive compulsive disorders. It's also a combination of the Shodhana, Shamana, Rasayana and Medya Anapa. And the best Shamana Aushadhis for OCD is Panchagavya Grita, and you can also use Brahmi Grita, and you can use the Shetavari Grita. So these are the three medicines which are very, very beneficial in case of OCD. The Brahmi Grita, Panchagavya Grita, and the Shetavari Grita. And these are the things which have been mentioned in the Apasmara chapter of Charaka Chikitsasthana 10th chapter, which you can use. And you get very good results with this. But it is not at all very easy to manage. See probably that's the reason why Charaka has mentioned this Atatva Vinipesha as Mahagada. Eko hi Mahagada. Because Asarva Samsarika Hetu Dukkavaya. It is a cause for the distress, the misery of the entire life. Because a patient is not able to differentiate between the Hita and Ahita, Sukha and Dukkha, the good and bad, real and danger, imagined and the truth. So that is where they really come across the different conditions. Yeah, in which conditions Kalyanaka and Mahakalyanaka Gritas? See, especially if it is milder to moderate symptoms are present, you can go with Kalyanaka Gritas, and if there is severe symptoms, you can go with Mahakalyanaka Gritas. See, in fact, we think that the Mahakalyanaka Gritas has more ingredients. In fact, Mahakalyanaka Gritas has less ingredients as compared with the Kalyanaka Gritas. But it has something called as Grishta Kshira. Grishta Kshira is the Sadyojata Go Kshira which has been used for preparation of the Mahakalyanaka Gritas. So because it has the Grishta Kshira or Sadyojata Go Kshira, that is why it is called as Mahakalyanaka, and it is said to be beneficial in the treatment. And if there is severe symptoms, you can definitely use it. See, but only thing is the availability becomes a problem because it is not easily available. But Kalyanaka Grita is easily available and we commonly use it. But we especially prepare for the patients. And see, one more important thing is what we also practice is this Grita, we sometimes prepare with the help of the Purana Gritas. These classical Gritas like Kalyanaka Gritas and Panchagavya Gritas Mahakalyanaka Gritas, etc. If you prepare out of Purana Gritas, you get still more better results. So this is what you can definitely try in a practice of using these Grita preparations. This is prepared out of Purana Grita. And then you get the better results in cases of the patients with severe chronic type of mental disorders. Yeah. Yes, Dr. Arka, now we can proceed. If you have any more questions, I think.
Is there any question?
Pawan sir has given my email ID also, drsuhashetty@gmail.com. And if you have any suggestions or if you have any discussion about any patients, either in your practice or anybody in your family, you're most welcome to contact me. I'll be very happy to help you in managing the mental disorders based on
Sir,
a little bit of. Yes, sure.
Sir, from last 2 to 3 months, I got 3 to 4 patients, 3 patients. They are from the army school. They are the army officer or the Jawan, and they are having the fear of death, and some of their family members have died due to the COVID. So in that case, I have prescribed them. Firstly, I have prescribed Mahakalyanaka Dhritam, Manasamatra Vatakam, Saraswata Rishtam, and I have prescribed also Brahmi Vati and Ashwagandha tablet of the Himalayas. But the patient doesn't have proper sleep, and every time he has some bad fear. And from last 6 months, the patient is not taking any antipsychotic drug, the modern medicine. He only take the Ayurvedic medicine from last 2 months, but he didn't get the proper result. So can you throw some light on this?
Sure. What happens is, what happens when the patient will irrational fear or irrational anxiety. If you just give any medicines, will not help you. That is where probably the psychology line of treatment or the therapies like cognitive behavioral therapies, because you have to change their thought process. See, this fear is a sense of a behavior or action, and the reason for this is the abnormal thought process. See, until you modify or modulate the thought process, you will not get the results. So that is the reason why probably indulging them in the social services, indulging them in love, compassion, probably helping the people in the society, seeing that they can always do some services for people who are suffering with this. Okay, so when they involve themselves in some activities, especially the charity and the social services, they get much better. And then you ask them to practice different types of meditation. See, all type of meditation will not help in all type of fear. So there are different types of meditation, like Omkara meditation, classical meditation, Zen meditation, mindful type of meditation, and transcendental meditation. See, that is why beautifully in Ayurveda, you say that there are different types of Prakriti and different types of Sattva, Satmya, Ahara, etc. And based on the preferences of the patient, based on their condition, you have to, because for example, mindful meditation could be beneficial for a Vata Pitta line of treatment, whereas the classical meditation could be beneficial for a Kapha patients, like patients who are having the relaxation process. Relaxing therapies can be beneficial for Vata and Pitta people. For a Kapha people, you don't need relaxing. You can advise for aerobic exercises or Surya Namaskara or some physical activities. See, that is why, definitely only Shamana Aushadhis will not help in case of fear, uncertainty and anxiety. You have to address these issues, and that is what. There is something called as Ishtadi Shabdaha Sukhavaha. Ishtadi Shabdaha Sukhavaha. Ishta Shabdadi. Shabda, Rupa, Rasa, Gandha. Because we are Pancha Bhautik in nature. Each one of us are dominant about, some people will have, if they see, they will be happy. If they taste, they'll be happy. If they listen, they'll be happy. See, you should understand what is their dominant Pancha Bhautik constitutions and what really works for them. If you are able to teach them something which is pleasing, if a person who is having the Akasha Mahabhuta dominance people, this will definitely help. Sharing them with some audio visuals for people who are having the Teja Mahabhutas will definitely help. So that is why you should be able to understand cases of the therapies. So only medicines will definitely not help in case of the fear, anxiety and uncertainty.
Okay. Thank you, sir. Someone has question regarding the Manasmitra Vadakam, I think. What's the question?
Causes anorectal bleeding. See, generally not. See, but what happens is, if at all, it could be coincidence, or it could be the person could have some other problems, or if the dose is too high, then the patient is Pitta Prakriti person, then you can think of the anorectal bleeding. So in such conditions, you can think of using Musta Churna or Avipatika Churna and stop these medications for at least 2 weeks. Then you can think of using it at a smaller dose. Otherwise, you can think of some Grita preparation, because that is also will do the healing process. Provided the patient has good Agni. Grita should be used only when the person has good Agni. Otherwise, it may not cause proper digestion of the Gritas. It will have good beneficial effect only when you have good appetite. So you should add Deepana Pachana along with the Grita and then give the patients. I think you can use some Grita preparations for this patients. If the patient is complaining of the, I think as my practical experiences, we do not get any such complications.
Okay. Thank you, sir. Thanks a lot. Is there any question from the participant, from the experts? Okay. So thanks a lot.
I would like to request Dr. Ashok Dubey for his comment, and then Dr. Vishnu Prasad Sharma for his comment for 2 minutes. Both dignitaries are here. Dr. Ashok Dubey is President Vishwa Ayurved Parishad Bihar. Dr. Vishnu Prasad Sharma is President Vishwa Ayurved Parishad Assam. Dr. Dubey, for 2 minutes, your blessings. You are mute, sir.
Many thanks to all of you. And as per subject, schizophrenia. Schizophrenia is a Greek word, schizen plus friend. Schizen means अलग करना. Friend means मस्तिष्क. तो मस्तिष्क को अलग करना, that is the schizophrenia. इसको फर्स्ट टाइम जो है आपके 2008 में 1908 में जो है ये यूलर द्वारा जो है तो नामकरण दिया गया था. और इसका इस तरह के जो schizophrenia जो है ये मानस रोग है और आयुर्वेद के अनुसार से इसको मतलब कि कफज उन्माद के में जो है इसको रखा जा सकता है, क्योंकि इसके जितने भी लक्षण हैं उसमें आच्छादित होते हैं. तो सबसे बड़ी इसमें क्या कि इसमें कौन से लक्षण आते हैं.
सर इस पे तो लेक्चर हो चुके हैं, आप आशीर्वाद दीजिए ना.
आशीर्वाद दूं?
हाँ, इस पे तो 2 लेक्चर हो चुके हैं, एक्सपर्ट्स बोल चुके हैं.
ठीक है. तो बस मेरे को जो है जब आशीर्वाद ही देना है तो तो ठीक ही है. और मेरा समय की वार्ता भी कुछ बहुत टाइम से हो रहा है. मैं सभी लोगों को जो है एक बार पुनः जो है तहे दिल से स्वागत करता हूं. और विश्व आयुर्वेद परिषद बिहार इकाई की तरफ से सभी जो वक्ता हैं उनको मैं पुनः एक आशीर्वाद देता हूं. और सबसे बड़ी चीज है कि मैं आशा करता हूं कि जो आप सभी लोग जब भी हम लोगों की आवश्यकता पड़ेगी तो आप पुनः जो है इसमें पधारेंगे और अपने ज्ञान से सभी लोगों को जो है वर्धन करेंगे, ताकि हम लोग जो है उसको कुछ सीख सकें और उसका साझा कर सकें. और अंत में बस यही कहना है कि मैं डॉक्टर पवन जी के सौजन्य से यह सब प्रोग्राम जो हो रहा है काफी सराहनीय है और आगे भी होता रहेगा, और ऐसी उम्मीद है. और हम चाहेंगे कि इस तरह के जो प्रोग्राम जो है हमेशा अनवरत हो और लोगों को शिक्षा मिले। हम अभी बहुत से लोगों को इसमें जोड़ने की कोशिश किए हैं। आज मैंने सबको काफी जो है उसको जोड़ा है और उम्मीद करते हैं कि जब भी आगे का कोई कार्यक्रम होगा तो उसमें सभी लोग साझा करेंगे। इस शब्दों के साथ जो है मैं पुनः एक बार सब लोगों को धन्यवाद देता हूँ और जो है खास तौर से हमारे जो वक्ता जो हैं दोनों वक्ता जो है काफी अच्छा इम्प्रेसिव था, टेक्निकल था और मॉडर्न और आयुर्वेद दोनों का कंक्लूजन भी था और सारी चीजों को जो सिजोफ्रेनिया से रिलेटेड है आयुर्वेद में इसमें आएंगे ये भी रिलेटेड है और इसकी चिकित्सा लक्षण सारी चीज से अवगत कराए हैं। इसके लिए पुनः पुनः धन्यवाद।
धन्यवाद सर, बहुत बहुत धन्यवाद। मैं अब आदरणीय डॉक्टर विष्णु प्रसाद शर्मा जी से प्रार्थना करूंगा और उसके बाद समापन की प्रार्थना करूंगा। डॉक्टर नवीन जोशी जी आज हमारे साथ मौजूद है आयुष दर्पण फाउंडेशन उत्तराखंड से, तो मैं डॉक्टर विष्णु प्रसाद शर्मा जी को प्रथम आमंत्रित करता हूँ।
नमस्कार, रेस्पेक्टेड डॉक्टर कुमार जी, रेस्पेक्टेड डॉक्टर Avum Kumar Sharma ji, distinguished guests, ladies and gentlemen. First of all, I offer my sincere thanks to Dr. Avum Kumar Sharma ji for organizing a beautiful schizophrenia webinar. Because schizophrenia is a worldwide problem. It is, though medicine is there, but patient has to take longer period. Ayurveda shows very good result in the management of this disease. Today's both the speaker, especially Dr. Gopakumar, has excellently described regarding this disease, and he correlates this disease along with Batik Mano, and he speak regarding how to manage such type of diseases, including Samsodon and Samsomon treatment. Again, Dr. Suhas Kr Shetty, he nicely described this disease and management, and he showed the management case report regarding management of such type of diseases. He also stressed use of herbs, made herbs, then Sirodhara, then Bomon, Viryasan, and Bosti. So now it is our duty to spread this message all over India, not only India, all over the world, that yes, we have a very good medicine to treat human disease, especially the schizophrenia, because schizophrenia is a worldwide problem. Whatever modern medicine is there, lots of side effects are there, and patient has to take longer cure. After taking that medicine, yes, symptoms, clinical features may be subsided, but again, if you stop the medicine, again, it aggravated. So our medicine shows very good result. So I offer my sincere thanks for the speaker, Gopakumar and Suhas Kr Shetty, for delivered very excellent talk regarding schizophrenia. Thank you to all.
Thank you, sir. Thank you very much. Now I would like to request Dr. Navin Joshi ji. Dr. Navin Joshi ji is founder of Ayush Darpan Foundation. Now we are collaborating for this holy mission of everyday celebration of Ayurveda. So I would like to invite Dr. Navin Joshi.
Thank you, sir. Thank you, Dr. Pawan Kumar Sharma, sir. It's my pleasure to associate with you, and I'm very much thankful to the whole of the team of Vishwa Ayurved Parishad Bihar, as well as the ZANDU pharmaceutical, which is giving up such a nice program in which Professor Gopakumar as well as other speakers are present, and they have elaborated the subject very nicely. And I am also thankful to the moderator of this program also. And Ayush Darpan Foundation is supporting this program by just live streaming this program on the Ayush Darpan General's Facebook page as well as on the YouTube page, where many of the doctors are enjoying this program. Thank you, Dr. Pawan Kumar Sharma.
Thank you. हम आपको तकलीफ देते रहेंगे, हमें एक्सपर्ट से सभी से आशा है।
आयुर्वेद की सेवा के लिए हम आपके साथ हमेशा जुड़े रहेंगे सर।
धन्यवाद, धन्यवाद, बहुत बहुत धन्यवाद जोशी जी। मैं सभी को दिल से धन्यवाद देता हूँ। मैं सभी से प्रार्थना करता हूँ कि 28 तारीख को मेंस्ट्रुअल हाइजीन डे पर लेडीज की सेमिनार है, कृपा कर अटेंड करें। 29 तारीख को 5 बजे से 7 बजे तक आजकल जो मार्केट में ब्लैक फंगस चला है उसको कॉम्बैट करने के लिए क्या आई केयर होनी चाहिए, उसमें हम वेबिनार कर रहे हैं। 30 तारीख को मल्टीपल स्क्लेरोसिस डे है, उसमें यूनिक एक्सपर्ट्स हमने इनवाइट किए हैं। 31 तारीख को वर्ल्ड नो टोबैको डे है, उस दिन हमारी 150वीं वेबिनार है। गुजरात के वाइस चांसलर, गुजरात आयुर्वेद यूनिवर्सिटी के वाइस चांसलर मेरे जूनियर भाई डॉक्टर अनूप ठाकर उसका उद्घाटन करेंगे। तो इसीलिए मैं आप सभी से फिर उसमें जुड़ने की प्रार्थना करता हूँ। That is 150th webinar for Emami, ZANDU, IRES, everybody. Thank you, one and all. Thank you very much, sir.